Now, early in the morning, to be talking about mathematics and figures is obviously always a tedious affair. But anyway, it is better that we do it in the morning rather than do it in the evening. And that is why my timings have been changed. And I hope I do a decent job of it. In the end of the day, if you are able to decipher what the numbers actually mean, and how do you actually look at them when you are reading an article, so that you can apply that particular article into your clinical practice, that is the basic job that has been given to me. And I hope I make a justice to it. I don't see so many postgraduate students in the hall, but all the same, the reason why we have included this particular topic in the CMA is because in most of the DNB and fellowship examinations, candidates are given articles, good articles obviously, randomized control studies or guidelines or some kind of meta-analysis is given to the candidate, and he is asked to evaluate them, and he is marked on that. And that is why from the examination point of view and then subsequently for your normal life point of view also, it is important that you are in a position to actually judge the article that is coming out by the dozens, by the tons in the academic literature. And so there's a lot of buzzword about this evidence-based medicine. Now, this is a definition which has been given to by Sackett. And Sackett is almost, I mean, if you read his articles, his books on evidence-based medicine, it opens a totally different worldview about what is all about, what evidence-based medicine is all about. And this is the kind of definition that he has given for evidence-based medicine. But I'll move on from here. I believe you have read this. That is a conscientious, explicit, and judicious use of current-based evidence in making decisions about the care of the individual patient. Now, so far as this definition is concerned, there's a lot of jargon there, a lot of English there. It doesn't make much of a sense. Now, when I want to teach evidence-based medicine to my fellow students, I just tell them that, listen, you have to find out what is the best thing that is possible in this world. And then subsequently, you marry that best possible thing with your expertise, your resources that you have at your disposal, and then but the answer that you get is the one that you would practice in your patient. So I have moved on, but then unfortunately evidence-based medicine means reading a lot of articles, and these articles contain a lot of numbers. So I have changed this definition. I've made a different definition of evidence-based medicine, and that I say that it is a mathematical estimate of the risk of benefit and harm derived from high-quality research on population samples. Now, they are mathematical estimates. We'll be talking about risk ratios and odds ratio and so on, numbers needed to treat and all those things. These are the ones which actually come into the articles, and these are something which we ought to know before we can make a conscious decision as to whether this paper is useful or not. And these are based upon probably high quality research, and they are done on population samples. Now, obviously, you can't have the whole population. You are doing the study on a sample and trying to extrapolate that result onto the whole population as a large. So, obviously, there is a caveat there. It is not extrapolated immediately. But then, if it is a representative sample that you have been taking, so it is important for you to know what a representative sample is. So, if you take a representative sample, it is likely that you can extrapolate the findings of that study, which is done on 100 patients, onto the population at large, so that you can apply to your patients. Now, the second thing is we'll be talking about populations. Now, North American population is obviously so different from South Asian population. So that is also something that you need to take into account. And these figures, a lot of figures come out from these studies, and they are derived from research on populations which you are trying to make decisions on an individual basis. So there's a lot of gap there. So you should be very careful about gap. So obviously, when you're reading papers, they are all original research, or they claim to be original research. And so what is the definition of research? Is focused, systematic inquiry aimed at generating new knowledge. And obviously, we know that research and audit and other things which go on in an ICU are not really synonymous, but research is something which is original and which you expect it to give you some new insight or new knowledge about that particular problem. But your job as a student of medicine is to distinguish genuine research, which should inform your practice, from the poor quality endeavors of so many well-meaning amateurs, which you should politely ignore. And that is the crux of the matter. That is the reason why that particular station has been included in the